Good afternoon, everyone. I call Committee of Supply Section C to order. We are meeting today to continue consideration of the estimates of the Ministry of Mental Health and Addictions. I now recognize the Minister to move a vote.
Thank you, Chair. Resolved that a sum not exceeding $26,715,000 be granted to His Majesty to defray the expenses of the Ministry of Mental Health and Addictions, Ministry Operations to 31st March 2024.
I now recognize the member of Surrey South.
Thank you, Honourable Chair. Through you to the Minister, when will the work will be complete that she was speaking about in her answer previous to the lunch break? When will the metrics and data sets be pulled together?
Minister.
Thank you, Chair. So the discussion that we were having before lunch was with respect to child and youth mental health services. And I had mentioned that the BC tracks the incidence of youth overdose throughout British Columbia. Their tracking has indicated a really flat rate over the last number of many years. We're seeing saw a slight uptick through the pandemic. So that's a data set that comes through the work that the BC CDC does. There's separate information. The Foundry produces their own sort of internal set of demographics. They do surveys with the children and youth that they are serving. That is a separate piece of that's separate information that they are collecting. We have started the evaluation process around the ICY teams. I think, as you know, the Integrated Child and Youth Teams are a new service, a new program that have been launched over the course of the last year. We have a number of those teams now just really up and running. The Maple Ridge Mission team started to have new intakes in last fall. So that information, the evaluation from that will take a little bit of time to follow through, but that work is underway.
Member.
Thank you, Honourable Chair. Through you to the Minister. With regard to the study on hypoxic brain injuries and that other study that was being conducted through the Ministry of Health, what is the timeline for completion of that work?
Minister. Oh, sorry, my apologies.
Sorry, Chair, excuse me. September 2023.
Member.
Thank you, Honourable Chair. What involvement is there for parents of youth who are discharged from hospital following an overdose incident?
Minister.
Thank you, Chair. The expectation would be that if a youth is in hospital as a result of an overdose, they would be released into the care unless they were detained under the Mental Health Act. They would be detained, or they would be, released to their family or guardian.
Member.
Through you to the Minister, of the total overdose events involving children and youth, how many have been amongst children and youth with concurrent mental health and substance use disorders?
Minister.
Thank you, Chair. What we know is that there are an estimated 26.5 of children aged 4 to 18 who have a mental health disorder, have 2 or more disorders concurrently. We don't have the precise detail data that the member is requesting with respect to concurrent disorder at showing up in hospital, but we'll make a request from health to see if they're able to provide that statistic. I can say that when I am engaging with partners and frontline providers across this space, they anecdotally report an increase of concurrent disorders amongst youth.
Member.
Thank you, Honourable Chair, and I thank the Minister for that response. It's my understanding that the Ministry is working on youth substance use post-emergency response. This was an item listed under the 90-day section of the Minister's transition binder. The note states that the Ministry is working on, quote, identify potential options for immediate term response, end quote. Okay, it's since been more than 90 days since the Minister would have been handed this binder. Is the action plan complete? And if so, what immediate term response options have been identified that will immediately address the rapidly increasing number of deaths and substance use amongst children and youth? Respectfully, through you, Mr. Chair, to the Minister.
Minister.
Thank you. Thank you, Chair. So the Youth Substance Youth Post-Emergency Room program is being developed in consultation with First Nations. So there is considerable work being undertaken with the First Nations Leadership Council, with Métis Nation, BC, as well as healthcare partners. The commitment has been to co-develop with First Nations increased youth mental health and substance use services, including crisis supports, culturally safe wraparound services, enhanced transition services, as well as improved emergency room, hospital-based care, and discharge planning for treatment and recovery services. So with respect to, excuse me, that last point in particular, we are working with Child Health BC, which is connected to out of BC Children's Hospital, on the development of clinical guidelines for physicians who are providing care for youth in hospital. We also work with Dan's Legacy, which is a community-based organization that receives funding from Mental Health and Addictions, and that also has an MOU with BC Children's with respect to providing crisis supports for youth post a hospital stay, sort of step-down supports. There are a number of other measures that health authorities have taken with respect to expanding youth services. Just by way of example, Island Health has 6 new youth short-term assessment and response teams that are doing outreach into community and in-reach into hospitals. We have, in Vancouver Coastal Health, expanded staffing for 4 intensive case management clinician teams, and that includes the new mobile youth outreach team in the downtown east side. There are expanded day treatment programs in Northern Health for youth with who need to access substance use services. So there are a variety of ways in which health authorities are working to expand those frontline services in the context of the youth substance use post-emergency program.
Member.
Thank you, Honourable Chair. Through you to the Minister. So the understanding then from my part is that the action plan, although working with many different groups and organizations and health authorities, is not complete. Can I please have a timeline on when that work is expected to be finished?
Minister.
Thank you, Chair. So this work is ongoing and, of course, very much supported by the investments we're making in Budget 2023. For example, the work that health authorities are engaged in involves recruiting 130 healthcare workers to work specifically with youth across the health authorities. So that work is ongoing. There are 123 youth treatment beds that the health authorities are working on standing up. So the youth substance use post-ER work involves a suite of measures that are happening in for which the work is underway and will be ongoing. It isn't a case that there is it's a case, frankly, of system improvement. We are always engaged in a process of continual improvement in our healthcare system. That's reflected by this the suite of initiatives that are underway. There really isn't an end date to it because we will be continually working to make improvements to these services.
Member.
Thank you, Honourable Chair. So will policy be released and updated at least as this work is continuing?
Minister.
Thanks. So I'm sorry, can the member just clarify which kind of policy? I'm just wondering, like clinical guidelines, or what sorts of policies is the member referring to?
Member.
Thank you, Honourable Chair. Just to clarify, so we're talking about an action plan so that people will be able to know what types of activities that the government is being engaged in, what type of policy directions they're going towards with regard to youth and children who overdose, and what the actions for dealing with their emergency care and then their aftercare. So all the things that would have been handed over to the minister in her binder, the action plan was complete. So what immediate responses were identified? And, so information released to the public on what was identified and what their responses will be moving forward.
Minister.
Thank you, Chair. With respect to the sort and I can appreciate the members' interest in what do parents know when they're when they have a child who is sort of in the healthcare system, and really the communication occurs in that point of contact with the healthcare system, and it is the healthcare practitioners who are providing the care that are in communication with the family with respect to what the next steps are and what resources are available. Are you okay? Yeah, okay. There's lozenges here. So one of the ways in which that we are pulling together all of the different sort of resources that are available across the continuum of care for youth is in developing a youth substance use framework, which the Provincial Health Services Authority is currently developing. That will be that's anticipated to be done with in about 12 to 18 months, and it will really just pull together all of the services that are available, including all of the ones that I've talked about today, including the work that's being done to provide supports directly in emergency rooms, for example, for youth, peer workers in hospitals to help youth and families navigate the system. That will provide us with a better sense of where there are gaps that we need to continue to work on filling out.
Member?
Thank you, Honorable Chair. I'll try to stop dying now. Excuse me, what investigations are completed when a child or youth overdoses? What happens, pardon me, what happens in the event of a death due to overdose with respect to a child or youth?
Minister.
Sorry, just to clarify the question is what happens in the event of a death of a child from overdose?
Member?
The question is what investigations are completed?
Minister.
Thank you, Chair. If a youth is in care and dies in hospital, dies as a result of an overdose, or dies as a result of any condition, that would be considered a matter which would generate a reportable circumstance report investigation through MCFD. The RCY would be advised, and it would be dealt with through MCFD. If it's not a youth who is in care, all sudden and unnatural deaths in British Columbia are, are sort of undertaken by the coroner, and the coroner may well decide to do further investigation or an inquest.
Member.
Thank you, Honorable Chair. So in the event of an overdose, when the child doesn't die, is there a subsequent investigation and follow-up done in that event?
Minister.
Thank you, Chair. Again, the same process for a youth in care applies in a situation where there is an overdose. That would be a reportable circumstance. It would go to MCFD, the RC, the representative for children and youth would be advised. For a child who's not in care, there would be discharge planning. There would be a clinical sort of engagement in the clinical sense, really around the discharge planning with respect to the next steps for that patient.
Member.
Thank you, Chair. Has the ministry correlated information to determine what underlying causes, sources, and commonalities exist amongst overdoses in children and youth so we can identify immediate solutions necessary to address the drastically increasing rate of deaths among children?
Minister.
Thank you, Chair. There is considerable work led by academics, by addictions medicine practitioners connected with the BC Centre for Disease Control that are doing work in this area. And what they've advised is that the likelihood of overdose is affected by cumulative adversity over the lifespan, early life adversity, social disadvantage and recent stressors, socioeconomic marginalization, neighborhood poverty, food insecurity, unemployment, and housing instability are correlated with overdose, with structural racism as a root cause. This is augmented by comorbidities such as, and this is the concurrent disorder issue, with substance use disorder, along with mental illness and chronic pain. And what they have assessed is that the likelihood of overdose increases fivefold when substance use disorder is present, and close to fourfold when mental illness is present. And the highest is overall for those with a dual diagnosis. They've determined that a third of BC youth and young adults who die by overdose had a mental health diagnosis as well. And I would say, Mr. Chair, that these outcomes in this analysis is very much what is driving the plan of our government. It drives path. This is at the foundation of Pathway to Hope. It is the substantial part of our budget investment this year to invest in upstream services and care for children and youth in order to impact these outcomes that we're currently seeing.
Member.
Thank you, Honourable Chair. Through you to the Minister, does the Ministry track how many youths have substance use disorder across the province separate from adults?
Minister.
Thank you, Chair. Member, we're through you to the member. We're tracking down that data. That data rests with Ministry of Health. So if we can either wait for us to get the answer, we can just provide the answer on background when it comes from the Ministry of Health.
Member.
Thank you, Honourable Chair, and I appreciate that. I just would like to have that information as soon as possible to inform me if that would be agreeable with the Minister. Through you to the Minister, in cases where children and youth have tragically lost their lives to a toxic drug overdose, is a full toxicology report completed?
Minister.
Yeah, thank you, Chair. We'd be happy to provide on background the process that the coroner goes through in reviewing what kind of testing the coroner goes through in reviewing deaths, particularly child and youth deaths. What I can say is that in the coroner reports, which I'm sure the member is aware of, the coroner reports on the incidence of fentanyl and carfentanil be detected in terms of the percentage of individuals who have died from toxic drug poisoning, and also reports on other types of drugs in their expedited toxicology reports with respect to drug deaths. So they are testing for fentanyl and analogs, for benzodiazepine stimulants, and other opioids. So if there's more detail that would be helpful, we can provide that.
Member.
Thank you. Through you to the Minister, can the Minister confirm if there is a separate report then, or part of the coroner's report, does it show what drugs are involved in child and youth deaths specifically?
Minister.
Thank you, Chair. That information is not provided in the coroner's public reports, and I'd suggest that it would be appropriate to ask that question through the coroner. Doesn't report up to to this ministry. It reports up to PSSG. That would be a question for PSSG.
Member.
Thank you, Honourable Chair, and we will follow up through PSSG to find out more information. But is the ministry tracking what types of substances youth are getting access to, where they are getting those, and how many, if any, for example, had hydromorphone in their system?
Minister.
Thank you, Chair. Yes, our health system through our health system database tracks the overdoses in emergency departments by diagnosis, and they can provide a breakdown of substances by alcohol, benzodiazepines, cannabis, cocaine. Opioids is a one category unto itself. I'd assume that hydromorphone would be in that category. We'll double check that with health. They track methamphetamine, fentanyl, and then there's a category for others. So that is the information that comes from health.
Member.
Thank you, Honourable Chair. So, sorry, can I just ask you to clarify? You said overdoses in emergency rooms, or is that all drug toxicity deaths, even those that occur in homes or outside of homes?
Minister.
Yeah, I'm sorry, perhaps I misunderstood your question. These are not in deaths, these are in overdoses that present to emergency departments.
Member.
With respect, through you, Honourable Chair, to the Minister, with respect to drug toxicity deaths that have occurred in children and youth, does the Ministry have information on what types of substances that youths are dying from in terms of toxicity, you know, and what are those prevalent drugs, and do they include hydromorphone? So specifically to youth, is the Ministry gathering data specific to toxicity deaths for children and youth?
Thank you, Chair. So as I noted earlier, the coroner does the analysis of all of the deaths from toxic drug poisoning, and in their public reporting, they identify where fentanyl has been detected, fentanyl and carfentanil, and they detect in a chart with respect to drug types detected in their expedited toxicology process for toxic drug deaths. They break down fentanyl and analogs, benzodiazepines, stimulants, and other opioids. And I would just suggest that for further breakdown of the coroner's reporting, that would be appropriate to ask that question through the ministry responsible for the coroner.
Member.
Thank you, Honourable Chair. So without gathering specific details related to children and youth, related to drug toxicity deaths in children and youth, how is, you know, in determining what substances, in what quantities, where those were accessed from, okay? So without gathering that information, how is this ministry accurately developing policy to prevent deaths in child and youth?
Minister.
Thank you, Mr. Speaker. So we've just clarified with health that it's our understanding that hydromorphone is not broken out. Hydromorphone would be part of the opioid category with respect to the reporting of drug toxicity. And, you know, with respect to the impacts of the opioid crisis on children and youth in particular, I would come back to many of the drivers that have been identified that I read into the record in response to an earlier question, and would point to the work that is done across our healthcare system by clinicians, by youth care workers, by all of the clinical providers who are experts in this field, folks who are working, for example, in the Council on Health Promotion and doing work on children and youth mental health and substance use. It's really their experience and their analysis of the drivers of substance use in children and youth that really points to the need, again, for the upstream investments and for working in a very integrated way, which is why we've been making those particular investments around integrated child and youth teams that pull in the school system as well, in foundry clinics, wellness clinics, which provide a really integrated primary care for children and youth. That analysis that's done on a regular basis through our healthcare system and through practitioners is what drives the policy interventions that we make.
Member.
Thank you, Honourable Chair. So no specific data is collected for the Ministry of Addictions and Mental Health with respect to specific toxicities found in children, is my understanding. So I'll move on to my next question, but perhaps the Minister wouldn't mind clarifying that, so that is the case, that no specific toxicological data with regards to what toxic substances are actually specific as common substances found in children and youth, that's not collected by this ministry. So in addition to the coroner's work, is the ministry tracking other harms as related to overdose? Do we know how many families and children specifically have been impacted through witnessing an overdose event or a death of a parent or loved one since the public health emergency was first declared?
Minister.
Thank you, Chair. Just to clarify on the initial point that the member raised with respect to the data that is available on drug toxicity, I just want to be very, very clear about what the coroner is reporting. So the coroner reports with respect to overdoses in children and youth. They report the numbers. And we can certainly provide this table to the member. They report the numbers of children and youth experiencing overdoses reporting in emergency departments. So this data is generated from the emergency department data system in our health system. We have the numbers for alcohol, benzodiazepines, cannabis, cocaine, opioids, including heroin, opium, that would also include the hydromorphone would be in that category, methamphetamine, fentanyl, and then there are a number of other or undetermined a category to capture that. In cases of where there is a death, the coroner reports, investigates and reports in their material again. By those categories. The coroner, as I understand it, has identified that hydromorphone specifically has been observed in less than 5% of drug toxicity deaths between July 2020 and 2022. That's overall deaths. The coroner has obviously finer breakdowns by death available, and again, we can either provide that member or, to the member, or the member can ask the PSSG, who is actually responsible for the coroner. But what I would want to emphasize is that the coroner and the information that we have from the coroner that guides our work is based on the analysis that the driver of toxic drug deaths is related to fentanyl, and so that is what we get from the coroner. With respect to tragic situations where children or youth might be exposed to a death in their immediate family or in their circle. We would, in some cases, that may be that Ministry of Children and Family Development is involved, or that Victim Services is involved. I would say that we don't have a number of youths in particular who have had that experience. But there are a number of programs which our ministry is standing up with respect to supporting children and youth who who may be in circumstances where they are experiencing challenges, or in areas where they're exposed to substance use. So programs, for example, that enhance support for pregnant and parenting individuals with substance use challenges, and some of that work is done through Children's and Women's. We have an expansion of the Confident Parents program, which is Confident Parents Thriving Kids, which supports parents with children aged 3 to 12 experiencing behavioral or anxiety challenges. We have the Mental Health in Schools strategy, which really is about embedding mental health and wellness programs right in the school system. For older youth, we've launched Here to Talk, the 24-hour mental health counseling and referral service for post-secondary students, in addition to the work that health authorities are doing around, directly providing treatment services to children and youth experiencing substance use disorder.
Member.
Thank you, Honourable Chair. I will take that reference material so that I can have a look at it. So if we're not tracking and we don't know how many families and children specifically are being impacted through witnessing an overdose event of a parent or loved one since the health emergency was declared, How will the government be able to, or are they concerned about measuring the scale of the crisis and the generational trauma that's likely to co-occur with our crisis?
Minister.
Thank you, Chair. I think I would just want to start by saying that I think there's no question that traumatic experiences such as a loved one dying, a member of your family dying, certainly being witness to that, whatever the cause of the death is certainly traumatic and can certainly have ongoing impacts in a child's life, in an individual's life. And I think that recognizing that is why it's so very important to have wraparound supports for children and youth when they are undergoing a crisis such as that. And again, we'll just point to the upstream investments that we're making that are designed to be able to identify and intervene and support children and youth when they are experiencing that trauma and other sorts of trauma. And again, sort of getting back to the issue of breaking down stigma, in some of the work that we've done, the Stop the Stigma campaign that we have run has been in part focused on family and on really promoting the importance of families being able to talk about these issues, about families and individuals being able to have community supports when going through bereavement processes associated with the impact of the toxic drug crisis. Community counseling grants are also an important mechanism for providing some of that upstream and community-based support. $15 million over 2 years through the Community Action Initiative to make that free counseling service available.
Member?
Welcome, Honourable Chair.
Thank you.
Through you to the Minister, for children and youth who may have grown up in households with opioid and other substance use, possibly even overdoses, what's the rate of subsequent mental health problems and substance use?
Minister?
Thank you, Chair. Welcome to the Chair.
You.
I think the member's probably well aware that there has been significant research done with respect to the impact of adverse childhood events on as a risk factor for future mental health issues, future health issues. In British Columbia, much of that work was done in the U.S. through the Adverse Childhood Experiences Survey. In British Columbia, we work through the Human Early Learning Partnership at UBC. They produce the Early Childhood Development Index, which is sort of the best kind of baseline data, I think, with respect to the impact of adverse childhood events on children and youth. So I can't answer for you today what the percentage is. Certainly, I'm sure that's in a research report somewhere. We can certainly forward some of the research that's been done through help to the member if that's helpful. But there is no question that that children and youth who experience adverse childhood events, of which witnessing a death is certainly one of them, that creates that is a risk factor for mental health issues down the road in their own life.
Member?
Thank you, Honourable Chair. Through you to the Minister, the Counselling Services grant funding that the Minister had referenced in not this answer but the previous answer, that are administered by the Community Action Initiative. The last record of funding that went out was March 2023. Was additional grant funding provided to continue services for this fiscal year?
Minister?
Thank you. Chair, some supplementary information to add to the member's previous question with respect to the impact of bereavement. One of the research organizations that we rely on for children and youth health information is the McCreary Centre. And McCreary has indicated that the Adolescent Health Survey, which is also a standard survey conducted through McCreary, will be asking questions about bereavement related to substance use. And I would note as well that the MCFD collects data related to emotional harm and critical injuries for children and youth who are receiving reviewable services. So there would be, perhaps some questions through MCFD that would help to illuminate that issue as well. With respect to the community counselling grants, yes, there was $15 million awarded through CAI to 49 local communities to continue counseling services that were already in place, and to ensure that those services are continued through March 2026.
Member?
Thank you, Chair. How many children and youth have been impacted by family dissolution or placed in foster care while parents or guardians were incarcerated or because they lost their parent or guardian to an overdose?
That is, thank you, Chair. That is not information that my expert team here has with respect to to guardianship or foster care, that would be through MCFD.
Member?
I'm going to ask another question, Honourable Chair, through you to the Minister, and I'm pretty sure that the Minister will also say that this is something that is in MCFD as well. I'll just ask it and then I'll sort of add on a little sub-question. The question is, how many children and youth have experienced neglect as a result of substance use disorder? So I recognize that some of these sets of data may be collected by other ministries, but I guess one of the issues is that, silos and working in silos and not necessarily sharing information that could be helpful in terms of creating the best policies, frameworks, and action plans to help children and youth, particularly those impacted by substance use disorder in their family or who've lost loved ones directly related to them, or who themselves might have an opioid use disorder or substance use issue. So how is this ministry working to share valuable information, especially with respect to children and youth, with other ministries that have purviews, I guess, that would involve these types of issues with children who are impacted either directly through their own substance use or on, I guess, because of someone in their direct family or someone who is their guardian?
Minister.
Thank you, Chair. I think this is such an important discussion to be having around how we break down silos, and it's been a particular I think focus of mine since I became the minister of this ministry to really be speaking to the importance of integration of mental health and substance use care in our healthcare system. Integration in terms of the work that we do with education, because what I've really learned is that these kinds of this crisis, which really kind of emerges from ongoing, as I noted earlier, in terms of what researchers and academics have identified as the kind of pre-existing risks for children and youth to develop substance use disorder. It comes from trauma. It comes from community dislocation. For Indigenous children and youth, it can really come from intergenerational trauma. And so having an approach that is a broader, integrated, kind of all of community approach is so critical in providing support to children and youth and their families and communities who are at risk in this space. Our ministry works. Our ministry really was stood up to work across ministries, to work closely with MCFD, with education, with health, and that the structural piece of that really is happens in terms of all of the coordination and cross ministry work. That happens at an operational level. It's supported, of course, by research relationships and partnerships with academic research centers such as HELP, McCreary, with health focused research centers such as work that's done through PHSA, through Children's and Women's Health. And it's really what is, I think, that realization, that understanding that it's important to be breaking down silos and working on a community basis is why we've prioritized the services like the Integrated Child and Youth Services. And standing that up with our K-12 system, with our local MCFD, with local health authority has been so important in creating a single entry point for children and youth. And it's a place where, and it's a model that incorporates peer workers as well that can go to where kids are. That is a really key point, is not requiring youth to come to where our health system is. We have to build a health system and a mental health and substance use system of care that can go to where children and youth are. That's really what the integrated child and youth teams are meant to be. Likewise with the foundation, the foundries. The foundries are just such an excellent example of integrated primary care. They incorporate mental health and substance use care into care, whether it's counseling services, harm reduction supports, again, a strong peer component in the foundries. If they need to see a doctor, they can get to see a doctor. They can get care, sexual health care and advice. All of that in one place. We are also working in terms of the sort of trying to break down silos and ensure that care and supports are culturally safe and appropriate, working with Indigenous partners to develop Indigenous-led solutions, particularly critical in this area where Indigenous people are so disproportionately impacted by the toxic drug poisoning crisis that we're in. So the member is right that with respect to this specific question around, how do we track the impact with respect to the foster care service. That really is, and issues around neglect. Those are that is a term in this space that is statutorily defined under the the Child and Family Community Service Act, that is the sort of province of the Ministry of Children and Family Development, and so I just would defer that specific question to that ministry. But there is, I think, no question that that we are working hard to break down silos, to work cross-ministry in a whole-of-government approach, particularly when it comes to children and youth.
And we'll take a 5-minute break. committee back to order. Member.
Thank you, Honourable Chair. So that's, thank you for the answer, Minister. So what about among adults and other ministries? Through the chair to you, I would like to know a little bit more information, if possible, about how the government as a whole is lensing the addictions crisis through each ministry.
Minister?
Thank you, Chair. So there are a number of ways in which government works cross-ministry, and I'll really just focus on the internal mechanisms to ensure that that the public health emergency that is the toxic drug crisis is reflected in the policy and the work of government. So, for example, with respect to the submission to the Select Standing Committee, that was a collective submission on behalf of health, mental health and addictions, MCFD, labor, and education, which really just sort of highlights the degree to which all of those ministries are working together on a regular basis. There is really an intersectional lens brought to major government priorities such as the housing strategy, which speaks to supportive housing, to complex care housing. Complex care housing, in fact, was the product of a cross-ministry committee, health, mental health and addictions, housing, in order to address the needs, the very deep and profound needs that people with substance use issues, mental health issues are require with respect to housing. That strategy also has a lens with respect to homelessness, on the toxic drug crisis. Our Safer Communities Plan, again, also brings together the Attorney General, the Solicitor General, Public Safety Minister, and Mental Health and Addictions to work collectively. That is the process through which we're developing community crisis responses. We work with across post-secondary to support post-secondary students. That's not only in terms of their role in developing the health human resources, part of the health human resources strategy, to ensure that we have the workers to work in this sector and provide this care and support. We also developed Here to Talk, crisis supports for post-secondary students. We, of course, work closely with SDPR. There are a number of issues with respect to the overlap between vulnerable populations who are in the social development and poverty reduction world, and the overlap between the health world and our world. So joint strategies there, and in that respect, we know that there is the link between individuals on social assistance and what their needs are with respect to risks, overdose risks, and also the role that SDPR plays in regard to supporting individuals who are in the correction system and coming out of corrections, and those who are needing to go into some kind of transitional housing, which may well be a recovery, treatment recovery type setting for a period of time. I want to finally say that it's a really important area of overlap is and joint work is with the Ministry of Indigenous Relations and Reconciliation, which is part of the work done collaboratively with health and mental health and addictions on Indigenous-led policy and Indigenous-led solutions for Indigenous health.
Member?
Thank you, Honourable Chair. So is there a framework of interministry cooperation and work as regular check-ins, in addition to project work or special committee work? Is there a framework that has ministries briefing the Ministry of Addiction and Recovery? So or mental health and addictions rather. When was the last time you received a briefing from the Ministry of Labour?
Minister.
Thank you, Speaker. And actually, thanks to the member. Labor was on my, actually on my list. I have some particular interest in the work that we're doing with labor on, workplace injury and the incidents, particularly of substance use disorder and opioid and toxic drug deaths, particularly amongst the people working in the construction sector and the transportation sector, which the coroner has reported is a significant, represents a significant cohort within those who have who are at risk of death from toxic drug poisoning. So just before I talk more about labor, there are at a sort of a staff level within government. I mean, not only are there cabinet committees at which issues related to social initiatives sort of come up that that provides a forum for discussion amongst ministers. There are also assistant deputy minister committees, as I'm sure the member is aware, and deputy minister committees that that deal with specific sort of areas, topic areas within government policy and government work. The labor minister and I will be meeting shortly to talk about next steps on addressing the very real and pressing crisis in the construction sector, in particular with respect to the risk of overdose death. I've had several meetings with construction associations, with worker representatives, and with others in that sector with respect to their with respect to the concerns and the advocacy that they're bringing forward.
Member?
Thank you, Honourable Chair. And through you to the Minister, when was the last time you talked to representatives from the construction industry?
Minister?
We're just checking my calendar, and so we'll get you the precise dates. But I've met with the construction industry rehab plan. I've met with the construction industry safety committee, the group of all of the construction safety associations. Both of those meetings happened either towards later in February or in March. And I met with the BC Building Trades on March 29th.
Member?
Thank you, Honourable Chair. So does the ministry ask for regular reporting from the various ministries on progress in dealing with addictions and mental health issues that emerge in each individual ministry?
Minister?
Thank you, Chair. Yes, there are a number of ways in which reporting happens on a regular basis. On the ICY teams, for example, given that it's a new program, we've been meeting quite regularly, and now we meet approximately every 2 to 3 months as we are scaling up additional teams. We meet with, really the work with housing and health is sort of so ongoing that those work processes are very integrated at a staff level, as well as at a minister's level. We meet biweekly with the Attorney General and the Minister of Public Safety on the Safer Communities Plan. The deputy, of course, is briefing briefs the Premier's office on a regular basis with respect to specifically to the overdose crisis. We've had joint work, have undertaken joint work on the Downtown East Side Action Plan. That's again been a multi-ministry process, SDPR, housing, health and mental health and addictions. So it is very much driven by the priorities of the work.
Thank you, Honourable Chair. So we were starting our estimates yesterday. We are continuing them today. And in that time, as many as 12 people may have lost their lives to drug toxicity in our province. It's urgency that we need, and identifying emerging issues as they arise instead of being reactive all the time. So I understand that there's a number of ways in which the ministry is working coordinatedly with things like the Integrated Child and Youth Mental Health teams, but with regards to how the crisis that we're in currently is impacting every ministry and having regular reporting. Is there a timeline? Is there a quarterly check-in? Is there a bi-weekly check-in, monthly check-ins, semi-annual reports? The reality is that when I think back on the pandemic, when I think about the COVID-19 public health emergency, we had daily reporting from public health. We had cooperation between labor and transportation, and everybody was working together very coordinatedly to deal with things, to get people back in the workplace, putting up these shields for people to be behind so coughs wouldn't get on them. But I don't see that same type of response happening here. So is there some specific framework from this ministry to coordinate responses that are happening across every ministry? Because a true recovery-oriented system of care doesn't just involve things that are in health ministries or mental health or addictions. A recovery-oriented system of care flows through every ministry. And so what type of reporting and what specific structure of reporting on the progress that should be being made in every ministry is happening right now in this government?
Minister?
Thank you, Chair. I just guess really just by way of starting, I might just observe that I think there is, you know, the COVID-19 public health emergency was of a bit of a different character than the toxic drug crisis emergency, and necessitated a different, just a, you know, a particular approach, given that we were dealing with a novel, very dangerous novel respiratory virus that was, you know, and the character of, you know, that emergency changed once we had a vaccine and a clear sort of path to exit from that pandemic. I think we all understand that the crisis with respect to drug toxicity and substance use disorder and addictions is of a different nature. That crisis really is one that emerges from many different sources. There are many different pathways to addiction in an individual's, in a person's life. And that is why you'll see a cross-government approach. But I would say that we're mostly interested in getting the work done. And so we're on complex care housing, for example. We have the numbers set. We're working with housing. We're working with health authorities on a regular basis, and with municipalities and partners to identify those opportunities. And internally in our ministry, constantly monitoring how those programs are progressing. Likewise with the other programs that have been developed in order to help support the kind of infrastructure that we need on moving to change the dial on this program, on this issue. And I can assure the member, I mean, certainly I get up every morning, the staff in this ministry get up every morning, the staff in the Overdose Emergency Response Center get up every morning, and they know that that there's going to be a toll at the end of the day. That very much drives the sense of urgency that we do have about the work that we're doing. It is deeply complex, deeply, deeply complex. And working in the way we are required to work, across partners, across ministries, on issues that are deeply rooted in the social determinants of health, that are very dependent on what happens in regard to the social determinants of health, is some of the most complex work I think that's done in government, and that's done by our partners and by our healthcare system. So we are very focused on doing the work every day to move and to advance the projects that we know are going to have an impact.
Member.
Thank you, Honourable Chair. So the Minister often refers to experts and studies. Are the organizations, nonprofits, are the experts that are used to provide studies, policy advice, analysis, are they listed publicly for the public to reference?
Minister.
Thank you, Chair. Yeah, there are a number of organizations, research groups, academic research groups that that do work in this area, that publish in this area, that have public-facing websites where their research can be found, whether that is the Canadian Centre for Substance Use, the the Centre for Applied Research in Mental Health and Addictions through Simon Fraser University, the Canadian Institute for Substance Use Research, which is a center through which there are a number of addictions and mental health and addictions specialists attached to. There is the Child Health Policy Center at SFU. There's, of course, the McCreary Center. There's the Human Early Learning Partnership at UBC. And all of the expert reports that were submitted to the Select Standing Committee, of course, are available on the website. I don't think there is a central clearinghouse where all of the research is available in one place. It is a matter of, of knowing which institutes are doing which work and being able to connect with their websites.
Member?
Thank you. So through you, Madam Chair, to the Minister. So the institutes and organizations have their work published possibly on their own websites, but so there is no way that individuals in the public would be able to go and find out who is doing this work for the government, or is that somewhere where they could find that and then subsequently go to this organization's website?
Minister?
Thank you, Chair. I guess with respect to whether, and I'm not entirely sure what the question is in terms of how does a member of the public find out what research is being done. I guess in that respect they would be, that information might be accessible through a connection that they had, that somebody had with, if it were a concern they had for a child, it would be through resources in the K-12 system. could connect them with some of these services or with the work that HELP does or with the work that McCreary does. If somebody wanted to find out more about, I mean, of course, any of these are available. I mean, in terms of the, the research and sort of academic nature of these, of the work that these organizations do, certainly available through any, sort of, digital search, Google search. I think our primary care system would be able to support individuals in connecting with some of this particular research if they were interested. We have in the Ministry of Mental Health and Addictions developed the Adult Substance Use Framework, which is really a description of the kind of system that is needed to be providing care for adults dealing with substance use disorder, sort of throughout the continuum. Excuse me, and that is available on the government website, and also has an extensive list of resources, expert sources, papers, academic reports that contributed to the development of the framework. Those are all sort of available in footnotes. So I'm not sure if that's the kind of information the member is looking for. But.
Member.
Thank you. And yes, thank you, Minister. Yeah, just in order for the public, again, it's about transparency. It's about knowing where the government's going in terms of who we're engaging with to gather information that's helping set policy direction for something that, British Columbia is setting the worst records for toxicity deaths in the entire country. We have one of the highest in North America. And I guess it's just about being able to find out, again, and looking for that sort of accountability, and how do we ensure that those who are providing us with advice, those who are influencing where policies are going, those whose research on which this government relies upon to set the direction, that people can have a look and know where that is coming from. So that is why I was asking that question. And so if source materials are put in each of the reports, each of the frameworks, is that the case, that when the ministry is putting out frameworks that the source information is being added to each? Okay.
Minister.
It is. I mean, it is important, and I very much agree with the member that, I think evidence in this space is really important. And I think that our partners in the health system and the providers and the physicians who are on the front lines of this also think that evidence is very important with respect to how we're moving forward. So, a report such as the Adult Substance Use System of Care Framework is footnoted with all of the inputs that have come in, with all of the consultation that's been done, so that can very easily be seen. And when we develop and produce the child and youth substance use framework that I referred to earlier in our discussions, that will also have the same kind of source documentation that the adult framework has.
Member.
Thank you, Honourable Chair. So after we had our discussion, for example, we talked about Fair Price Pharma, and the minister advised me that they're a non-profit pharma company. I actually went to Facebook and did a little research of my own. And I saw something that I thought was kind of interesting, and I'll just read it, and then I have a couple questions. So it says, compassion clubs can become a reality now because Canada has a domestic pharmaceutical heroin producer. Health authorities can make an injectable heroin purchase from FPP, that's Fair Price Pharma, that can be dispensed from compassion clubs. For Vancouver, a minimum of 200 people is required for service covering the Lower Mainland in BC. There is a 400-person minimum. Pre-filled syringes are expected to be ready 3 months after the contract signing with the relevant health decision makers, Vancouver, Coastal Health, VIHA, and Interior Health. Through you to the minister, what policy direction is being set and what has been worked on with regard to compassion clubs in the Ministry of Mental Health and Addictions?
Minister.
Thank you, Chair. I think as I have already been very, very clear on the record with respect to the question of our government's approach, we are operating on the advice and guidance from our provincial health officer with regard to our prescribed safer supply program, which started with risk mitigation guidelines in 2020 in the midst of the COVID-19 pandemic and was meant as a response to the profound disruption and profound risk that COVID-19 posed to people with substance use disorder and people who are using illicit drugs. That was further developed in 2021 through our prescribed safe supply clinical guidance, and our work is focused on the parameters that have been well articulated by the Select Standing Committee on Health with respect to scaling up the number of prescribers who are able to prescribe safe supply, addressing issues with the regulatory bodies in that regard, ensuring that on an ongoing basis the clinical guidelines are being developed and kept refreshed as knowledge transformation and evidence accumulates through the delivery of prescribed safer supply.
Member.
Thank you, Madam Chair. Can you just please say yes or no? Is the minister, respectfully through the speaker, can the minister please answer yes or no? Are you working on a framework or policy related to compassion clubs? Because we have this company here that clearly is preparing, getting ready to be dispensing from compassion clubs and even saying how many people they want to serve in Vancouver. And it just seems sort of weird that they would go all that way and do that, even in a nonprofit, if there isn't sort of like some groundwork laid where they actually believe that would be the case. So is the ministry working on policy related to compassion clubs, yes or no?
Minister.
The Ministry of Mental Health and Addictions is not working on a policy with respect to compassion clubs.
Member.
Thank you. I'm going to just read something here from CBC, and it really is related, getting back to some comments that I made in a response from the minister with regard to the sense of urgency with the number of individuals dying every single day in our province from drug toxicity deaths, from addictions. And it's actually related, it's a related comparison to COVID and the COVID response. And this is actually an interview conducted just a couple of days ago here with BC's Chief Coroner, Lisa Lapointe, on CBC Today, and the person asking the questions was Michelle Elliott. And in the interview, our Chief Coroner says, as I say, we don't have a system to support people to wellness, and yet there's a huge stigma where there's a general feeling where people should just keep to themselves. This is a health issue that really needs support. We know outcomes are tragic. We know 6 people are dying every day. As I said in the media release, it's almost incomprehensible that we stand by and watch 6 people die every day, week after week, month after month, year after year, without a massive response, the kind of response we saw for COVID. We just haven't seen that. And that's the end of the quote. So does the minister stand by her words that this is a response similar to that of COVID, and that they're putting in all the effort that they possibly can? And why is it that we don't see the sense of urgency in saving lives when actually, I have the numbers here, we've already, so 2022, yes, saw almost actually equally the amount of people succumb to COVID as died in the opioid crisis, Madam Chair. For COVID, we lost 2,383. We now know we have the deadliest year for drug toxicity deaths. 2,314 people lost their lives, and yet we do not see a parallel sense of urgency, a parallel action of urgency that we did during COVID. So when will the ministry step up their response to the level at which would be expected when we're losing more than 2,300 people in a single year?
Minister.
Thank you very much, Madam Chair. And I want to start by saying that I appreciate the advocacy and the passion and commitment of the Chief Coroner, all of the work that, the important work that she brings to this discussion, which I would note is unrelenting, is complex. There is no one who will not, who would not acknowledge the complexity of a toxic drug crisis that poses dramatic challenges to our frontline health providers. But I will say, Madam Chair, that the work that is done day in and day out in our healthcare system by physicians, by nurse practitioners, by social workers, by community mental health workers, by workers in supportive housing, working in complex care housing, working on a peer basis, reaching out to vulnerable people in challenging circumstances, the work that they are doing every single day to try to protect and keep people safe who are at risk of the poison drug supply is extraordinary. And I know they feel that sense of urgency every day, just as we do. When we stood this ministry up in 2017, it was precisely with the purpose of honing our resources and focusing in on a problem that at that point no one had anticipated it would grow to the situation that we are in today. But we could see the writing on the wall in terms of the increased presence of fentanyl in the drug supply and the impact of that. And that is why we stood this ministry up. That's why we worked with such intention and focus in those early years to set up additional harm reduction supports. We grew overdose prevention sites from a handful to 41 now across the province, which we know, according to the coroner, has saved thousands of lives. We have scaled up access to treatment beds, community counseling, working at every point on the continuum of care, because we can't do just one thing in this space, we have to do all the things. The COVID-19 pandemic had a profound effect on the progress that we saw. The progress that we saw as a result of the efforts of our government in 2017 and 2018. And we are now working hard to regain the ground that we lost over the course of the COVID pandemic, which disrupted our communities profoundly, disrupted access to overdose prevention sites, made it harder for people to gather, made it harder, ruptured our communities. The communities that are so important in protecting each other and working together to protect against overdose. There is no question that we are in a situation where, with the increasing toxicity of the drug supply, a situation which is getting more and more complex for our frontline care providers to address every single day. That, coupled with many of the other pressures and challenges that people are experiencing in our communities, makes this perhaps one of the most sort of wicked problems that that a government, any government anywhere, is dealing with. Our sense of urgency around this is found, frankly, in a number of areas. It is found in an unprecedented $1 billion investment in Budget 2023 in mental health and addictions services. It is found in the work we have done on the housing strategy to urgently ramp up our efforts on housing so that we can support people to have stable stable living environments, which is so key to the prospects for continued wellness for people who are dealing with addiction issues. We are working with the CDC on scaling up access to naloxone, access to those harm reduction services that we know are so critical. Industry is helping out by developing things such as the Lifeguard app to try to help with the alerting of toxic drugs in communities. And we have laid out a plan in budget 2023 that will see the development of new and innovative approaches, seamless approaches to care, so that we can catch people, fill the gaps and catch people in those places where we are at risk of losing them. We are working with Indigenous partners on addressing the real and pressing issues with respect to access for First Nations and Indigenous people to care in this province. All of that work is happening and is being led by folks across our health system and in our government who indeed feel a profound sense of urgency.
Member.
Thank you, Honourable Chair. Welcome. And through you, respectfully, to the Minister, I'm not talking about the work of healthcare professionals. I, was on the front line dealing with people who both died from drug toxicity, dealing with their families, rushing people to the hospital, performing CPR, delivering life-saving naloxone to people. I know that people on the front lines of this crisis are working hard and with a sense of urgency. I'm talking about this ministry. I'm talking about the work being done. This was a minister that yesterday couldn't define effective and responsive. How do we, and not able to say whether the things we're doing, yes, I understand $1 billion is a huge investment of the taxpayers' money from their pockets. But when we don't know what the results are, and we don't know what the metrics are, we don't know what's killing kids from the drug toxicity because that data is not collected. When we know that we see that the death panel review from 2022 of drug toxicity deaths took 204 days. When we talk about yesterday, the Select Standing Committee on Health's report that we haven't had a response from the government in over 158 days now. So I'm not talking about the response of medical professionals. I'm talking about the response from this ministry, this government. So I'm going to ask, can the minister confirm today if the 3-year priority action list as laid out in the Pathway to Hope is fully complete and implemented? And if not, what pieces are delayed? We're talking about delays or otherwise incomplete.
Members, just a reminder, I've been with the minister and had her teams having a conversation. Let's try not to disrupt them. Thank you. Minister.
Yeah, thank you. Thank you very much. And apologies for the time that it just took for me to collate that information. I am aware that that we are due to provide a report on an update report on the Pathway to Hope, and I will certainly take responsibility for the delay in that. I had wanted some fairly substantial edits to it when I assumed this ministry, and staff are working on that process. So we'll have a document out soon. But in the meantime, I can certainly run through. If anybody's looking at Pathway to Hope on page 11, that sort of is the 3-year snapshot of what we had hoped to accomplish. So under the column of improved wellness for children, youth, and young adults, with respect to supporting support for pregnant individuals and parents with substance use challenges, that program has been developed and launched. There, in the last quarter of 2022-2023, there were 1,733 dyads served across 18 community organizations. With respect to promoting early childhood social and emotional development, that work is really ongoing in much of our work in child and youth mental health with MCFD and with the Education and Child Care Ministry. With respect to enhancing program in early child care centers, there is a pilot underway right now in conjunction with MCFD. With respect to expanding confident parents and thriving kids, that has been accomplished. Expanding Foundry Centers, that is underway, and in fact in this budget we have provided $75 million in additional funding such that we will have 35 foundries, funded by the end of this budget cycle. Mental health in schools. The mental health schools in strategy was developed and implemented by our colleagues in the education sector. We established integrated child and youth teams. The step up, step down, specialized care home beds and intensive day programs, that work is underway. We did create virtual counseling for post-secondary students. With respect to the second column of work, supporting Indigenous-led solutions, we implemented the tripartite MOU with the First Nations Health Council, the First Nations Health Authority, and the Government of Canada. A 10-year strategy to achieve progress on social determinants of health and wellness was developed with our participation through the First Nations Health Council, and that document was adopted by the governance structure amongst the nations. And that work is work that we're very, very much engaged in through the First Nations Health Council and the First Nations Health Authority. With respect to embedding cultural safety and humility across the provincial system, I would say that is an ongoing project. Expanding First Nations run treatment centers, that is a project that is under the leadership of the First Nations Health Authority and is underway. Expanding Indigenous land-based cultural and healing services. There was a $30 million investment to fund 154 projects across 72 communities, which has been completed. And we have allocated a further $171 million in this budget in order to further support the work and the sort of evidence that was gathered through that process around First Nations-led, Indigenous-led healing and healthcare services. Enhancing capacity for Métis Nation BC and priority setting and planning. We have a table with Métis Nation BC. We've provided capacity funding, and that work is underway. Supporting nation-led primary healthcare initiatives. We've opened a nation has opened in Williams Lake, and Stehalison is providing primary Indigenous-led primary healthcare. With respect to substance use, better care, and saving lives, the framework for improving the substance use system of care is something that we've already had a chance to discuss a bit. That's the adult substance use framework. That's been completed. That's available on the government's website. Ensuring best evidence guides care in British Columbia. This really relates to clinical practice guidelines for opioid agonist therapy, for alcohol guidance, etc. Those clinical practice guidances have been updated or available, and of course that work is ongoing as there is a constant process of knowledge translation in healthcare. Increasing access to evidence-based addictions care, that is underway. Integrated team-based service delivery to connect people to treatment and support the ongoing teams. Those teams have been stood up. They are operating in Abbotsford, Hope, Fraser Canyon, Nanaimo, Cowichan, Shuswap, North Okanagan, South Okanagan, and I'm sorry, I can't read my own writing, but we can get you the complete list. The overdose emergency response, including community-based harm reduction services, of course that work is ongoing. Supportive recovery services, of course the work supporting our recovery and treatment sector is very important. In 2019, we brought in regulations to better support that sector. As well as revised updated standards in 2021. I would note that in 2019, we also, for the first time in a decade, increased the per diems that were available through SDPR to that sector. The work with the provincial peer network is of course ongoing. The input of people with lived and living experience is critical to how we develop programs and policies moving forward. And in the final column, improved access to better quality, expanding access to affordable community counseling. We've done that, and we talked about those programs earlier. Team-based primary care with mental health and substance use professionals and specialized services. This point really speaks to the integration of this area in our primary care system. And that is something that is critically important, very close to really a priority for everybody working on the front lines of our healthcare system. It's critical that when people are accessing primary care, they can access these services. So we have, through health and through the development of primary care networks, have the vast majority of those primary care networks have recruited staff with mental health and substance use specific classifications to ensure increased access to mental health and substance use services. I would note as well that several of the Foundry centers are connected through primary care, which is another way in which we are working to break down the silos that we talked about earlier. We've hired 230 additional FTEs across our primary care system, which includes primary care networks, also community health clinics, First Nations primary care clinics, nurse practitioner-led primary care clinics, and our urgent primary care centers. So that work, I'd say, is always going to be underway, but I think we've made some substantial progress in the last few years. Enhancing the provincial crisis line network, yes, that work is underway. We have an active project with PHSA, and we're very grateful for the collaboration and support of community-based crisis line operators and the provincial organization that's working with PHSA on that project. With respect to the framework and standards to improve care under the Mental Health Act, we, of course, have introduced the Rights Advisor now and are standing up that service to better advise individuals who are certified under the receiving care under the Mental Health Act. Also introduced a new set of accountability standards in 2020. Implementing peer support coordinators and developing peer support worker training resources. That work has been completed. There's a curriculum now. 89 individuals have been trained in peer support, and that work is separate, I will say, from the very innovative and really first-of-class work that was done to develop the peer training curriculum that is used to train peers, youth peers who are working through the Foundry Network. The expand bounce back, we've expanded bounce back. Mental health and wellness disaster recovery guide, that's been completed. On workplace mental health, there's been substantial work done, and of course always more to do on workplace mental health. And we did create a web-based portal which focuses on children and youth.
Member.
Thank you, Honourable Chair. So I asked what's not implemented yet, what pieces are delayed or otherwise incomplete. I know you just did a run through, or the minister just did a run through of everything, Honourable Chair. But let's be clear, can you please just clarify, because this is going on the record and the public's probably watching, there's probably hundreds of people right now, they knew that the minister would be there, they want to tune right in. So ongoing and underway means not done, is that correct?
Minister.
I'd say that in the context of our healthcare system, where we have a process of continual improvement, ongoing and not ongoing means that the work is underway. The work is may not yet be completed, but I would say that on most of these items, we're going to continue to do that work.
Member.
Okay, thank you, Honourable Chair. And 35 funded foundries. Does funded mean operating?
Minister.
Thank you, Chair. 35, we funded 12 additional. So there are, in Phase 1 and 2, the Phase 1 and 2 centers that were funded between 2015 and 2018. Those are all open in Abbotsford, Campbell River, Kelowna, North Shore, in North Vancouver, Penticton, Prince George, Richmond, Ridge Meadows, Vancouver Granville, Victoria, and Terrace. The Phase 3 centers, which were funded through Budget 2019, are opened in Comox Valley, Langley, Caribou, Chilcotin, that one's located in Williams Lake, in Sea to Sky, and we are just in the process. The projects are under development in Burns Lake, East Kootenay and Cranbrook, in Surrey and Port Hardy. There are 4 centers that where they were a little further out in the planning, in Fort St. John, Sunshine Coast, Kamloops, and Tri-Cities. And then there are an additional 12 funded in Budget 2023.
Member.
Thank you. So funded doesn't necessarily mean operational. Can the minister confirm that a second progress report for the Pathway to Hope plan was completed last fall and has yet to be released as stated in her transition binder on page 52? And if so, will the minister immediately release this progress report?
Minister.
As I'd indicated in my previous answer, fully take responsibility for some edits that I was looking for to that document. Staff are working on those edits, and I anticipate that the progress report will be released in the short term.
Member.
So this just points, Honourable Chair, to a lack of urgency, I would say, honestly. We're talking about, the opioid crisis, and, we had quite actually a spirited conversation, I would say, about, the sense of urgency, and there are delays. And I think that, having, again, and I'm happy to hear the minister taking responsibility for the delays, but we need things to be done in a timely manner. We need to ensure that the work that needs to get done to ensure that people are, guided towards wellness, recovery, making sure that they have the harm reduction and counseling services that they need, the access to health care that they need. We can't afford to have, even just among reports that help guide us in this province, there shouldn't be delays. And Pathway to Hope was a limited 3-year action plan from 2019 to 22. So can the minister please answer through you, Honourable Chair, what work is being done right now to identify new priority actions?
Minister.
Yeah, thank you very much, Mr. Speaker. Just with respect to Foundry, just to clarify that, we have 15 foundries open and operating. We have four that were funded in 2019, close to operating, another four that are further out, and then 12 that we've actually just funded. So those will be a little further out, but it does indeed take time to stand up these services. Although I will say that that the team at Foundry Central is getting very adept at the model. In many cases, for Foundry, we're also working with local partners, which at times adds some complexity. So that's just with respect to Foundry. And I, would say that with respect to report, I mean, frankly, my take on things coming into this role was that it was very important, in fact, to get to work and to make sure that we were acting with urgency on the programs that we know are going to help move the dial. And so it is very true. Editing the progress report has fallen down the list of priorities precisely because we are working to actually do the work and deliver. The priorities that flow from the next step of broadly captured by Pathway to Hope, which is the 10-year sort of mental health and substance use plan, but really informed, of course, by what we're learning as we move through, in particular, the toxic drug crisis. And you would see that reflected in the mandate letter, which speaks to my mandate letter, which speaks to the items that were in the previous minister's mandate letter, continuing on with that work, much of that work around complex care housing, around some of the public safety work, also some of the child and youth work. And then in addition to that, stating quite clearly the direction to take into account the unanimous recommendations of the Select Standing Committee on Health, with the support from the Minister of Health, to continue to lead and accelerate BC's response to the illicit drug toxicity crisis across the full continuum of care, prevention, harm reduction, safe supply, treatment, and recovery. Talks about the need for expanding complex care treatment, recovery, detox, and aftercare facilities across the province. That work is underway, funded in Budget 2023 in partnership with Providence Healthcare to build a seamless model of care. We have significant investments for complex care to continue that work. Working with housing on additional supportive housing, working on strengthening the governance guidelines and best practices for evidence-based care in the prevention, treatment, and recovery system, and that is work that is underway in partnership with those community-based partners in the treatment and recovery sector to strengthen those. To strengthen the standards around how that sector operates, in addition to an expansion of the number of beds. So, I mean, I'll leave it at that, but really it's the mandate letter that is driving the priorities that the ministry is working on right now.
Member.
Thank you, Honourable Chair. Well, the Minister also confirmed that internal progress reports have been completed for 2021 and 2022, and will she commit to releasing those internal progress reports today as well?
Minister.
Thank you, Chair. Yeah, there is an internal progress report available for the 3 years ending 21-22. Happy to provide that. I would just ask that you read that in conjunction with the Pathway to Hope report when that comes out, because that will be more up to date than the internal progress report. And there is no internal progress report for 22-23.
Member.
Thank you, Honorable Chair, and I would gladly take those documents as soon as possible. And is there a timeline, since it's the Minister says that it's only edits that need to be done, through you to the Minister, what's the timeline when we can expect the other information to be, the Pathway to Hope to be released?
Minister.
Yeah, thanks very much. I mean, I have asked, have asked staff to, expedite to the best that they can the edits that need to be done to the report. They're working diligently to do that. Once we get through this process, we'll have a little bit more capacity on the ministry side of things, and I'd anticipate that it will be, it's a matter of weeks, certainly not a matter of months before that will be out.
Member.
Thank you, Honorable Chair. Oh my gosh, so dry. I'd like to talk a little bit about the integrated child and youth teams. The target, Honorable Chair, for 20 teams is once again being delayed. It should have been the target for this fiscal year according to the 2021 service plan, but now it's moved to 24-25. Given the ministry's current track record in failing to have more than 5 operating in implementation, what guarantees can the minister offer that BC will ever meet the initial target for 20 teams? And even more so, when will we be able to have that expanded beyond 20 communities?
Minister.
Thank you, Chair. The Integrated Child and Youth Teams has been, it's been, I would say, a bit of a journey trying to stand up a new, innovative model across 3 ministries in the middle of COVID. And I do just want to take a moment to express gratitude to all of those, all of the people in our K-12 system, in school districts who have worked so closely with all of the staff in the Ministry of Children and Family Development in communities where we've been standing up these teams, and of course the workers in our health authorities who have been key. There have been considerable challenges and learnings from the early parts of the process around building up a team that is drawn from 3 separate ministries with 3 separate sets of operating procedures with different requirements in terms of information sharing. So at the outset of this, of the development of this program, it was necessary to work through developing a standard template for information sharing, to work on developing shared operating policies across the 3 different ministries, to work on really developing that sense of integration, which is new to this area and new to this kind of work, and made just maybe slightly more complex by the fact that school districts operate independently. They're not they're not they're not sort of ministries or part of like under direct government direction. So there were a lot of I'd say a lot of moving parts at the outset, and I think that the work has been done has really sort of nailed the model in a way that is very helpful in terms of standing up the teams that are going to follow. I just have to acknowledge as well that we know we have some recruitment challenges across different sectors across our labor force, including some areas that have impacted and made it a little bit slower to get some of these teams launched. But we do now have teams operating in 5 school districts: in Maple Ridge, Pitt Meadows, in the Comox Valley, in Richmond, in Coast Mountains, and in Okanagan, Similkameen. We are also expanding teams to 7 new communities, including Fraser Cascade, Kootenai Columbia, Mission, Nanaimo Ladysmith, Okanagan Shuswap, Pacific Rim, and Powell River school districts. So we currently have 5 school districts and 12 teams operating. We are in the process of expanding teams in 7 new communities, which will result in 11 teams for a total of 23 teams. And then we have a selection process that is underway for a remaining 8 locations, which will be informed by our work with Indigenous partners, as well as just ministry partners. And the expectation is that all 20 school district teams all of the teams operating across 20 school districts will be operational by 2025-26.
Member.
Thank you, Honourable Chair, through you to the Minister. So given the current child and youth mental health and substance use crises, is the target still frozen at 20 teams in 25-26? Or is there going to be more of an acceleration?
Minister.
Thank you. And actually, I did mean to say that there's, the ICY teams are working somewhat in conjunction in terms of resources, with the expansion of Foundries, and our priority will be to build out the system. As we're doing this work on the ICY teams, to build out the access to primary care through the Foundry network to the additional the communities that are currently underway, and then the additional 12 foundry centers that we've identified and that we've funded in this current budget.
Member.
Thank you, Honorable Chair. Through you to the ministers, that's a lot of numbers. So can you clarify, please, Minister, is the commitment to have all 20 teams operating by the end of 24-25, or will still there be some left in the implementation stage?
Minister.
Yeah, thanks. Sorry for that. That is a lot of numbers. So let me just to clarify that the target is to have 20 teams operational by 24-25, and 23 teams all of the teams operational across 20 school districts by 25-26.
Member.
Thank you, Honorable Chair. Through you to the minister. The service plan shows that once again the ministry has failed to meet its target set for integrated child and youth mental health and substance use teams in operation or implementation. The target for 22-23 was 10, and the update forecast shows that still only 5 district teams are operating or in implementation. The service plan further states that the Okanagan-Similkameen and Coast Mountains are still in implementation. The Okanagan-Similkameen and Coast Mountain teams were first announced in September 2020, over 2.5 years ago. How many vacancies are there for Comox Valley, Maple Ridge, Pitt Meadows, Richmond, Coast Mountain, and Okanagan-Similkameen, and for which positions?
Minister.
Thank you, Chair. In the Coast Mountain, on the two teams in Coast Mountain, we have 8 of 18 positions in place. We've done a bit of rejigging to have school counselors ensure that they are in a position to be seeing children, and we have that team operational. It is seeing children and youth. The Okanagan team has 4 of 8 positions in place. There's 1 team in the Okanagan, and again, that team has started seeing children and youth.
Member.
Thank you, Honourable Chair, through you to the Minister. Last year, in regards to the Maple Ridge Pitt Meadows team not being fully staffed, the previous minister made mention of, quote, wait lists have been reviewed and children and youth and families have been offered services as applicable, end quote. What current waitlist data is available for these services? Is it broken down by community, region, type of service, and what needs are, or sorry, type of service in need and age?
Minister.
Thank you, Chair. So with respect to the wait list, and actually, let me let me start by saying that children and youth can access services of an integrated child and youth team from a number of different places. They can access it through the peer outreach work that's done with the team, through the health authority might refer teachers or families in the school might refer youth to the team. The only wait list that comes into play is the wait list through MCFD. So MCFD has priority one children and youth with the most acute needs, which are seen by child and youth mental health counselors. The priority 2 and 3 on their wait list are what are referred to the ICY teams. We don't have those wait lists, that's MCFD, but we can certainly get that information for you.
Member.
Thank you, Honourable Chair. Through you to the Minister. When we were talking about shortages, vacancies, I noticed that you did not mention Comox Valley, Maple Ridge, and Richmond. Are they fully staffed, or are there shortages in those locations as well?
Minister.
Yeah, thanks. Apologies for the oversight there. Comox Valley has 15 of 19 positions staffed. That's across 2 teams. The Maple Ridge Pitt Meadows team has 20.1 of 23.6 FTEs staffed.
Member.
Thank you, Honourable Chair. Through you to the Minister. For the other communities that are still waiting, what stage of implementation are they at, and how many positions have been filled to date? So what funding or recruiting strategies are in place to ensure that their targets are met this time around?
Minister.
Thank you, Chair. So the work that's being undertaken right now with respect to ramping up the next group of ICY teams involves work being done jointly by the Ministry of Mental Health and Addictions and the Ministry of Education and Childcare. There was a ICY team and school district conference last few days ago, last a week ago or so, to share best practices. They're starting to really create sort of a community of practice across school districts and the other and health and MCFD, which is really encouraging. There has been a series of town halls for employer groups who are involved in the communities that will be building up the teams in to answer questions so that they understand what they need to be doing on the ground. And staff from the Ministry of Mental Health and Addictions and the Education and Childcare Ministries will be meeting with those groups in May to provide direct support on the ground for the work, for them to support them in doing the work that needs to be done by school districts, by health authorities on the ground, and by MCFD to begin to build those teams, and we're benefiting very much from the work of a retired school superintendent from Maple Ridge to help us with that work, which I think is a really good example of just the degree of integration that's happening across these teams. So 12 to 18 months is the anticipated time frame to do that work.
Member.
Thank you to the minister for the answer. Thank you, and I'll just, before we move on, and I think it's almost time for moving or to conclude for the day, but could the minister just confirm those numbers again for the vacancies for Richmond?
Minister.
For Richmond, as of February, there are 4 teams in Richmond, and there are 16 of 27 positions in place.
Member.
Thank you, Honourable Chair. I'd like to talk now about Foundry. For the 8 centres that are currently in development, when are each of those scheduled to open and begin providing services?
Minister.
I have general information for the member, and she may well want more specific information, which we can track down and bring back next week when we reconvene, if that works. But what I can say is that for the center in Burns Lake, that the lead agency there is the Carrier-Secani Family Services organization, and they are expecting to open in 2024. The East Kootenay, Cranbrook area location is operated by the Tanaka Kinbasket Child and Family Services organization, and they are anticipating opening between 23-24. Surrey will be operated by the Pacific Community Resources Society, and that is, we're just under discussions with them about about space and such. Port Hardy is operated by the North Island Crisis and Counseling Center Society, and that's anticipated in 23-24. And I'm certainly happy to get in touch with folks to get a more clear sort of status report about where the development of those centers are at. And then the other 4, Fort St. John, Sunshine Coast, Kamloops, Tri-Cities, those are the 4 that are somewhat further out. Those are 25-26. I will say just about those that, I mean, lead agencies have been identified for each of those centers. It's a question of those, working with those agencies to identify the space and such.
I ask the minister to move the motion.
Honourable Chair, I move that the committee rise and report progress and ask leave to sit again.
The question is that the committee rise, report progress, and seek leave to sit again. Those in favor? Aye. Opposed? Motion is carried. Thank you, members. This committee now stands adjourned.